Hi, this is the last recording, the third recording for the musculoskeletal system and CPT surgery coding. And we are to talk about next bunionectomies and any other operations on the toes. And as far as your main terms go, what is the main objective of the procedure? Bunionectomy or excision would be a main term. And sometimes you might find in the index under the actual diagnosis, like hallux rigidus versus the main term relieve probably isn't one that you're going to want to use. The caution here is to be sure that you are reading the op report, understanding what particular areas and joints that the surgery or treatment is taking place in to identify the correct CPT code. You also have reference to CPT assistant in a couple different areas, bunionectomy and the hammer toe or claw toe, correction or fusion. The next section is cast and strapping, and so do read through this and identify when casts or strapping can be reported. Again, as we mentioned in the fracture section, when it's the initial treatment of a fracture, the casting or strapping or traction is included in that initial treatment. If a patient comes into the emergency room after an injury and sees the ER doctor, and the doctor does the x-ray, so on, and just puts on a temporary cast of sorts and asks the patient to see an orthopedic surgeon as soon as they can get into that clinic, you might be reporting the casting then. So you would have an emergency room E&M service code, and then you could have your casting code there because he didn't actually treat the fracture per se. So there are a number of bullets listing some requirements for reporting, and do look at those, but keep in mind the initial main guideline that I've mentioned a few times here in the different recordings. And lastly, we have endoscopes or arthroscopies. Again, visual examination of a joint. So one of the things that you want to keep in mind is something that is said right away here in the textbook. Arthroscopy codes include codes for a diagnostic arthroscopy in each anatomical site. So when a surgical arthroscopy is performed, that is maybe an arthroscopic meniscectomy or meniscus repair, a diagnosis arthroscopy is automatically included in that. However, if the purpose is just an exploration arthroscopy, you can code the arthroscopy. If it converts to an open inspection, that is an arthrotomy, an incision into a joint, then you are going to want to code both the arthroscopy, diagnostic one, and the arthrotomy. Okay, and your book clearly identifies that. So you're going to want to read the op report closely for that reason, and then also for what are they doing once they get in there. Are they doing anything at all, or is it just an exploration diagnostic? Or if they are repairing ligaments or the meniscus, getting exactly what they are doing. Is it a repair? Is it a removal? Is it a debridement? And so on. Lastly, in your chapter here, it talks about HCPCS codes commonly used, and some of these here are medical devices or supplies, and so we are not going to worry about those in this particular class, as you don't have a code book for those. With that in mind, as I've instructed in the assignment area, You do not have to list any of the J codes or so on. You are just going to have your surgical CPT code. So when you are doing exercise 4.3, when you're looking at number 4, you have a choice of A, B, C, D. Each of those start out with a surgical code. That's what I want. I don't care about the other A codes afterwards. Okay. Some of your choices like A and D have multiple surgical codes. Any questions? Just let me know. And this ends the last recording for the surgery musculoskeletal system. Thank you.